Hi, I'm Roisin. I'm currently an FD in Newcastle in England, and I intercalated in Maastricht University in the Netherlands, and I did a master's in global health, Queen's in Belfast. So I'm from Northern Ireland, so I studied in Belfast. I intercalated between third year and fourth year. In third year, we actually had a lecture on intercalating just to let us know about it, which was quite interesting because I hadn't heard of it or considered it before. And then at the time, I was kind of interested in a career outside dentistry. So at the time, it was sort of in public health, and we'd done a bit about research. So I was quite interested in that. And then I found out about this course through a girl who did medicine in the year above me, who'd intercalated and done, it was a global health course in Maastricht University. And she was telling me about it, and I just thought it sounded really good because I was kind of interested in doing like a public health master's to intercalate because I was really interested in that, and that's sort of what I was going to go into. So I think I applied to public health in Queen's and in Glasgow, and then I heard about this, and then because it was global health, it just seemed a lot broader and a lot more interesting, and there was opportunities to travel and everything, and I just thought it sounded really, really good. So it was more hearing about the course and everything made me really want to do it. Once I heard about that one, I was like, yeah, this is the one, because before that I was kind of unsure, and I was like, I could do public health, but in Belfast it was a lot cheaper to do it than in Glasgow, where I'd also like applied. But I liked the idea of living somewhere else for a year because I'd obviously been in Belfast for 3 years and it's near my house, and I was kind of like, oh, I could live, you know, in a different country. It was like €2,000 to do it in the Netherlands, whereas in Glasgow it was like £8,000, I think, and in Queens it was like 5,000, and I was like, that's so much, and it was like way cheaper to go away. So I was like, that was a deciding factor as well, but it was a lot less expensive. So I studied a master's in global health. So we had various topics. So one of the like modules we had was on a research module. So we learned about qualitative research, we learned how to write a research proposal, we learned about quantitative research, and we learned how to use, it's called SPSS, which is like a quantitative research kind of tool, which helps you analyze data. So that was quite good because we had a thesis later on to write. So we had a lot of background in it, and we learned a lot about research and how to do it before we had to do that, which was good. So there's a whole massive sort of emphasis on research in it. But we also did modules about sort of global health. So one of the modules was sort of on policy making. So we looked at different policies in different developing countries and why they were created, and if they worked and if they didn't work and why they didn't work. And at the end of that module, we were in groups and we had to like create policies and like present them, and it was like a competition and stuff. And then there was another module on like, it was called like governing global health. So we learned about how globalization was affecting like people's access to healthcare, how government controlled healthcare, and like global powers who kind of also had a hand in healthcare, like the World Trade Organization, the World Health Organization, and how they impacted it. So it was like really interesting because we got a whole global view. It wasn't like specifically to your country or like a government. It was like based on politics and economics and stuff, which I hadn't really, like, I didn't know that much about in general. So it was really good in that kind of way. And then the way it works as well is, I think because it is global health, they have a lot of emphasis on working with people from different countries and different cultures. So for that policy kind of module, we were on Zoom with people in a different uni, but it was like a sister uni who were also studying global health. So ours was like a uni in Canada. So like every week we'd have a Zoom kind of class with people from Canada and like discuss and read papers and stuff, which was quite good. And it was also weird because obviously now everything was on Zoom, but at the time it was like this like new thing, and it was really good actually. And then there's a whole like opportunity to travel in it. So they have all these sister unis. There's like one in Canada, that one that I said, one in India, Thailand, Sudan, Colombia, Norway, and then Maastricht, which is Netherlands. And then for the second semester, you can do a placement in one of those unis. So I spent 4 months in India in the second semester, and you just join a uni there. So you can kind of pick one based on what you're sort of interested in. So like mental health or something. So I did public health in India, and we just joined like a class doing a master's of public health for 4 months. We still had some classes in Maastricht, like online ones too. And then we had to join that class. So you like learn so much about different cultures, and like I like visited all these dental practices in the dental school and stuff in India, which was crazy, like so different to here. And it's just mad just learning about how different people, like how different countries work, and like as well as healthcare, just like everything. It was really good. So as I was saying, the opportunity to travel was the main reason I did it, and the best thing I got out of it, I think, because I met so many new people. Maastricht is a university town, and it's because of that, there's so many people who's your age, and I lived in halls, and I lived with a girl who was from Portugal, from a girl from Brazil, and a girl from Germany. So it was just meeting all these new people, and hopefully maybe after this we can go visit them at some point. And because the way Maastricht is, it's at like the bottom of the Netherlands, but it's really close to Belgium and it's really close to Germany. So it was so easy to travel at the weekends to visit all these places I'd never been before. And also the stuff that we learned was so interesting. It was stuff that I'd never heard of, stuff that I'd never even thought about, even things to do with politics, things to do with how different things like globalization, people moving to more crowded cities, how that affects healthcare, how that would affect people coming to different countries to, you know, practice like being a doctor or being a nurse, and then how that would affect that country, and just how interconnected everything is that I hadn't even thought about before, and learning how to critique things. I always find in dentistry, everything's very like, this is a fact, learn it, repeat it, and that's it. Or like, this is how you do this. Whereas this was so like, it was really problem-based learning. You had to go and read it and then come up with your own opinion. And I just learned a lot doing that because I'd never done or learned like that before. And it was really interesting. And then obviously you have the opportunity to travel so much. And at the end, so even if you decided to stay in Maastricht for the second semester, everyone has to go to India for 2 weeks in May. And then when you do that, the uni gives you like €1,000 so that you can pay to go. So everyone meets up in India, and obviously we were already in India, so we traveled the whole way around India, went to the Taj Mahal and everything. We went to a wedding in India, and we met so many people, and everyone was just so nice. And I learned a lot about India. I learned about like myself at the time, and yeah, that's what I enjoyed the most, probably meeting new people. And we did a thesis, so that was like the third semester is you write your thesis, and I really enjoyed that as well. So the whole thing was really, really good. At the end, at the third semester, you have to write your thesis, which you can write it in a thesis form, but they do encourage you to write it as a research paper, and they encourage you to kind of join a research group on any kind of research that you have a background in or you're interested in. So obviously I was going to do mine sort of dental related, and I kind of, because we started Queen's like fourth year in the middle towards the end of August, and this course ends at the end of August, I knew I'd have to be back in Belfast and kind of be able to start class. So I couldn't really travel, but a lot of people did travel for the third one as well, but I decided to apply for a couple at home. So I just contacted, it was a head and neck cancer specialist nurse in a hospital in Belfast, and she was interested in doing a bit of research on the quality of life of people who had teeth removed due to head and neck cancer. So that's what we kind of did it on. They do encourage you to think about your thesis quite early on, so you are very well prepared when you come in, and they obviously give you a lot of background in research and how to do it, and you have to write a research proposal, and it's graded and everything, so you have a very good ground. And you have one-on-one meetings, and they help you find a research project if you don't have one, so they're really good in that way. So yeah, and they do encourage you to join a research group, because they know that if you join that, they'll probably want to get it published, so that you already have like a foot in the door if you do want to do future research. So I joined this research group, and because it wasn't affiliated with Maastricht, they kind of let my supervisor in the research project supervise me and grade me on my thesis as well as somebody in Maastricht. So they were so good about it, like they made it so much easier. So that was the main thing that came out of it. But then because of that, I got a chance to like do a literature review before I started it. And then like I carried out the research and I wrote the paper, and then we got it published in the Journal of Dentistry. And then because it was a research group, they like want you to present at conferences and stuff. So I presented it at there was a head and neck cancer conference in Leeds that year. And also there was an Intercalators conference in Bristol. So I presented it at both those. And then they did like a head and neck cancer audit in the hospital where I did the research. So I presented it there as well. So I did actually get a lot because they put so much emphasis on the thesis. I got a lot of research experience from that. And then because then I was part of that research group, like they've contacted me about doing like a systematic review and stuff later on. So you're kind of, you've already got your foot in the door if that's what you're interested in. And it gives you so much experience writing like research, what goes into it, and then also presenting at conferences and stuff. I think I looked it up for this year, and the window of applying is from the 1st of October to the 1st of May. So of that year, so then you'd start again in September, which is quite a big window. You just like, I think you create an account online and then you apply through that. And then it asks you to upload certain documents like a photocopy of your passport and stuff. And then it does ask you, you have to have like a bachelor's degree, and dentistry was my first degree, so I didn't have that. But after I like passed my exams in 3rd year, then I asked like the head of the school to write, it was like a letter that said, oh, like 3rd year of dentistry is the equivalent to like a Bachelor of Science. And then I uploaded that and that was completely fine. And then you get accepted. You can get accepted even before you have uploaded all your documents. So I think I got accepted about January or something. So I'd obviously applied before Christmas, got accepted in January, and then you pay your fees. And then it was about €2,000, I think, for the year. And then you do get 1,000 back because you have to go to India. I will say it's probably different now because of COVID. I doubt there's the same resources to travel. It's probably very much online, but in the next year or two, that probably will change with the vaccine, and they probably will try and open it up. And because that was a real like selling point for the course, and that's what they really, really pushed, like the opportunity to travel, working with other people. So I do think they'll try to open it up, but just to say that, I'm not sure how it's going at the minute. In our uni, it was sort of a refresher course, and it was about the week before we started to 4th year. It was only the people who intercalated came in, and we worked on phantom heads. And I think it was 3 days. So we had like an amalgam day and a composite day, and then we had a root canal day, which was really good because like I hadn't held a drill in a year and I was so nervous. And you do like, it comes back to you quite quickly, but I found the practicing really helpful, even just working with everything again. And it did come back, but that was really helpful because they went through root canals and it was just easier than even reading up on the theory before, because it's just not the same as doing it. But I would say the main thing that really helped was having other people who had intercalated in my year. I think there were 8 of us, and it just made it so much easier because you always knew people and you could be like, oh, what's this again? Or it wasn't really if you didn't know stuff, and it did make it better. And I would say maybe just read over the theory of everything you're doing at the start, because I was quite busy with my thesis. And I feel like I should have got more, like read over the 3rd year stuff a bit before starting, but that was just me. Definitely apply and then see what happens after that. It was actually one of the best years, and it was really nice to have a break from dentistry and a break from Belfast. And I honestly had the best time, and I met some really great people. So I would say no matter what you're doing, if you're thinking about, even if you like dentistry and you just, want to do something else for a bit, because it can make you really like dentistry as well when you come back to it. So I would say leave all doors open and apply, and you'll probably have a great year.